A nurse from Pekin is fighting for her father's life against a healthcare system she says is failing him. After months of bouncing between hospitals, battling infections, and undergoing open heart surgery, 61-year-old Gregory Coffin was discharged in March.
But now his daughter says he has nowhere to go and everything he owns is gone. WMBD's Shab shows us why she says it comes down to something he caught at a St. Louis hospital. Shab.
Yeah, Rebecca Thomas, Samantha Everett is a nurse who's navigating the healthcare system as a daughter. She says her father, a Navy veteran, has spent the last 6 months in and out of hospitals. But now her biggest battle is finding a place for him to live.
It just really made me realize how broken our healthcare system is, because I know he's not the only one that this happens to.
Samantha Everett says her father, Gregory Coffin, went to the hospital for heart surgery, but left with something else. She says he contracted a dangerous drug-resistant fungus, and now no nursing home will take him.
Nobody told me, he even got it there. Nobody explained what it was. Like, I found out from it when I showed back up to visit him, and all of a sudden he was in an isolation room.
Now here's what Samantha said happened. In November of 2024, her father Gregory was admitted here at OSF St. Francis Medical Center in Peoria for severe heart infection. After months of bouncing in between hospitals, he was then transferred to Barnes Jewish Hospital in St. Louis. That's where he underwent complex open heart surgery and then was placed under a ventilator.
And I was not for sure if he was going to make it out of it or not.
Samantha, a nurse herself, says that's where he caught a drug-resistant fungus, Candida auris, or C. auris, and she's got the tests to prove it. So your father was tested twice for this fungus, came out negative, but this third time came up positive.
That's correct. Yep.
C. auris primarily spreads in hospitals. It can be deadly for people with weakened immune systems.
Because it's particularly sticky, it does stay in that environment, and it affects people who have higher risk.
And Samantha says that new diagnosis changed everything. When Gregory was discharged in March, she says Barnes's nurses told her 70 nursing homes turned him away.
I'm trying to figure out why, what's going on. The only thing that I could figure out would be this infection that he picked up, this fungus that he got while in Barnes.
Hillary Spencer with the Illinois Department of Public Health says C. auris alone should not prevent Gregory from finding a nursing home.
It really shouldn't be a limitation. A facility needs to be able to implement the appropriate precautions.
I reached out to Barnes, left messages for multiple departments, but never heard back. When Samantha picked her father up from Barnes, he was disoriented and confused.
So I took him right back to OSF in Peoria. So we went back there, and he was admitted that same day. Quickly, they deemed that he was not able to make decisions, should not have been even allowed to choose to leave.
Samantha says OSF also tried to find a nursing home for her dad. She even made calls herself, but still, nothing.
He has the C. auris, and they basically were like, he can't be in a room with somebody else. So he needs a private room, and Medicaid's not going to pay for that.
I reached out to the Illinois Department of Healthcare and Family Services, which oversees Medicaid. In a statement, they told me Medicaid does cover single occupancy rooms. Reimbursements to nursing homes depend on the resident's needs, not the type of room needed. I mean, how does this whole experience make you feel?
It makes me have very little confidence in our healthcare system. I mean, and it also really just sheds a light on those who don't have people to advocate for them.
Now, according to the CDC, Illinois has reported more than 1,600 cases of C. auris since 2022. And as of today, Samantha is paying for a small apartment in Pekin for her father, but with her own family and 3 kids, it's just not something she can afford. Additionally, Gregory's car, with everything he owned inside, was repossessed the last time he was at OSF. For the longer version of the story and how you can help Gregory get back on his feet, head on over to our website. That's ciproud.com.